Chief Executive Officer, and Mrs. Kelly McGrath, who is the Mental Health Care Navigator for Navicare. Can I ask you to make a brief opening statement?
Yes, thank you so much to the Mental Health Select Committee for inviting us today. We're really pleased to be here, to have this opportunity. You've already heard enough, I think, about the suicide rates almost doubling in rural and regional Queensland and the issues around access to mental health. We've already heard that it's difficult to attract and retain quality staff. There's a lack of funding. There's those extensive waiting lists, and people need to travel long distances to access mental health services. So Wesley Medical Research, in collaboration with QT and, very importantly, local stakeholders, co-designed a bespoke model of mental health care. We applied rigorous health services and implementation science methodology and consulted over 60 stakeholders in the Bowen Basin region to begin with, from local health providers, the Primary Health Network, council representatives and community organisations. And what those stakeholders told us is that help seekers want to speak to a human being, and they want to be able to walk into a building where they can speak to that human being, but they don't want that building to say, come here if you've got mental health issues. And basically, if they can have that initial conversation with a person, then they're more likely to access telehealth services as well. So as you can imagine, you know, people that are looking for support often aren't in the frame of mind to understand what's available, where do they need to go, what are the eligibility criteria, how much will it cost them, and all of those things. So what we've designed with the community is this new layered mental health navigation model, and it has now been implemented, and it's called Navicare. The model comprises a care navigation team, a physical hub, and information services with virtual facilities. The very first Navicare hub was established late last year in the Isaac region, and it's already received tremendous support. And the beauty of this model is that it caters for a specific local community, but it also has sufficient flexibility to adapt to other regions. And it's guided by the evidence-based exploration, preparation, implementation and sustainment framework. Navicare hasn't just received referrals from the Isaac region, it's also received referrals from Mackay, from Whitsundays, Central Highlands, Rockhampton and even New South Wales in its short time that it's been operating. And the role of Wesley Medical Research as a research institute is to develop this model, it's to pilot the model, and ideally we do so for about 3 years, and importantly to capture the right data and evaluate the effectiveness of this model and adapt it as required to fit the community needs. And ideally, we'd have sufficient funding to establish Navicare across 3 regional Queensland communities. And it would include an economic evaluation over time, and then potentially transition Navicare to existing mental health service providers. And, you know, you've already heard from Outback Futures, with whom we've had multiple conversations and so forth. So piloting Navicare is critical to establishing an evidence base for scaling up and sustaining improved access to mental health services in regional Queenslanders, linking help seekers with the support they need. And I'll now introduce you to Kelly McGrath, our first mental health care navigator.
Thanks, Claudia. I'd also like to thank the committee for this opportunity to highlight some of the disparities that rural and remote Queenslanders face in accessing mental health support. So, as a mental health care navigator, my role is to connect individuals with mental health support. When I first went into the Isaac region, I had expected that there would be a reasonably limited number of on-the-ground psychology services. I was absolutely shocked to find that there were less than I could count on one hand, and one of those only services, their employee assistance program contracts, so the general public couldn't access it. For a local government area of more than 58,000 square kilometres, to say that this is inadequate mental health support is an understatement. Navicare's made significant progress in overcoming some of these issues by developing critical relationships with a number of telehealth psychology providers, including some of the wonderful organisations that you've already heard from today. Now, while those services have been invaluable in enabling Navicare to connect help seekers with the psychological supports that they need, telehealth is not an option for some populations, and we've found that in our experience. In addition to this, recent Medicare cuts have all but eliminated bulk billing telepsychiatry appointments, and 70% of Navicare's client base have delayed accessing mental health support because they simply can't afford it, even at a lower rate. So, even since our launch in November, the role of the mental health care navigator has expanded and evolved. Very quickly, it became apparent that the social, economic and environmental factors that underpin a person's need for seeking mental health support need to be addressed concurrently with the psychological intervention. Without doing so, it's the equivalent of treating a broken leg with a Band-Aid. It just doesn't work. I've had to link clients to essential services such as emergency financial relief, legal supports, emergency housing, employment supports and community and social supports as well. And these key linkages are now a key feature of the role of the mental health care navigator. Since our launch in November 2021, we've received up to 21 new referrals each month. I'm case managing 51 clients. Our oldest client is 73 years old. Our youngest is 4. 1/3 of Navicare's clients are under the age of 18 years, and half of these are presenting with self-harm or suicidal ideation. I work at the coalface of the mental health care landscape, and I have seen firsthand the enormous benefit that help seekers receive when accessing the right mental health care at the right time. Our preliminary data demonstrates that these impacts are life-changing, not just on a personal level, but have enormous potential to positively impact the community, the economy, and the health system. Some of our clients have re-engaged in the workforce for the first time in decades. They've stopped abusing drugs and alcohol. Some have stopped self-harming and having thoughts of suicide, which reduces the load on the health system. The Navicare model was co-designed with the community, and it is making a genuine difference. Should the funding be available to pilot the program for 3 years, our stringent evaluation expects to demonstrate very strong social, community and potentially large economic benefits. Mental health care navigation fills a critical gap that is imperative to giving each help seeker the opportunity for a full recovery and the opportunity to live a happy, healthy and fulfilling life. Rural and remote Queenslanders deserve this. Thank you.
Thank you. So Navicare as a model is really a care sort of coordination activity, or is it more than that?
It is so many things. Yes, it is care coordination, but there's also a lot of community engagement. Mm-hmm. We're working actively to destigmatise mental health amongst the community, raise awareness of the fact that mental health supports do exist, maybe not physically on the ground, but we can provide those key linkages. Mm.
So it's not just about sort of connecting people to sort of one-on-one treatment type services, there's a broader remit than that.
Absolutely.
Yeah, okay. But it would be fair to say that from what you've presented today that while it's good to be trying to navigate people towards various services and individual treatments, if they're not there, it must be very challenging to help people.
It absolutely has been a challenge, which is why we had to think outside the box, and we've engaged with a number of online psychology platforms. Rural Health Connect are one of our go-tos. Mm. They're on speed dial for us. And so in developing those relationships, they were critical in enabling Navicare to perform that role of linking help seekers with essential supports.
Mm. And it's probably, if you're operating in an area like that, it's possibly the first time someone's gone in and actually had a reasonable look at what services are, available from a holistic perspective.
That's right. That's right. Yes. So when we began this work, we didn't really know what the landscape looked like ourselves, and so it was very interesting to be engaging the various different stakeholders and understanding exactly what was going on and just how much support was required. We are really pleased to have the Mayor of Isaac Regional Council as basically the champion for this, and she was in tears when we launched in November last year, so we're really pleased that it's had this uptake and that we have this backing of the community.
Yep, she's an impressive woman, Anne. And you services obviously work with people affected by alcohol and other drugs as well. You would have been aware of the social isolation report that was delivered in Parliament previously, again identifying that need to sort of support people and connect people into their community. Are you working in both of those spaces as well, the alcohol and other drugs and the social isolation?
I do connect people with the alcohol and drug supports as necessary. They also, when they identify that clients that have been taken into their programs, if they have certain risk factors like self-harm and suicidal ideation, they will then refer to Navicare for that higher level psychological support that they feel that client needs. So it's a two-way street.
How do people find Navicare?
Well, we like what we've heard, and it's really difficult when you're sort of
I mean, when you got someone like the Mayor of Moranbah talking you up, I'm sure it's not that hard, but...
What we've been told is that, everybody's quite excited, and in fact we have some reference letters from various different stakeholders, and we've got written support from, the Greater Whitsundays Community Development, from the Mackay Mayor, from the Isaac Mayor. We've visited the North Queensland PHN and had discussions with them. We've spoken to the Assistant Health Minister. We're engaging mining communities as well. So and we're actually funded by a corporate donor at this point for a period of time. So we're very much hoping that we'll be able to extend this work.
Thank you. I might go to the member for Moggill for a question.
Thanks very much, Chair. And before I ask my question, I will declare a conflict to the committee, and that's just that I am a former board member of Wesley Medical Research, and I continue to be a specialist physician member of Wesley Medical Research as an accredited visiting medical officer of Wesley. But congratulations on this submission. This looks really exciting, and the collaboration between various organisations, mayors, as you've outlined, from a local government perspective, mining, and also with people from Rural Health Connect and Outback Futures as well. What I really wanted to ask was the specific additional funding that's needed for Navicare, what that would be, just to get a sense from a government perspective of what would be of assistance to augment what already exists there. And then with the evaluation framework with the Australian Centre for Health Services Innovation, OSHI, that economic, social and health evaluation, what's sort of planned with that? Because when I read the submission, the applicability of what's been already achieved to date has wider implications, I guess, for other geographical areas, and particularly with the collaboration amongst various stakeholders. So to try and give complete success to the pilot as far as, the funding that's needed, but also the evaluation, if you could just outline a little bit more about that.
Thank you. We've been saying we've got funding for 12 months, but that 12 months quickly becomes 6 months. And we'd really like to be able to have Kelly in Moranbah for 3 years at least. The funding that we're requesting is to support Kelly's role, the lease that comes with that, the travel, the telehealth services, etc. We'd also like to establish other hubs in regional Queensland and follow the same model that we've already used to define what specific needs each community need, and then also establish that the database. We've got a database for the current hub, but we need to establish the databases for the others to be able to measure the outcomes. Indeed, the relationship with OSHI is fantastic. They do bring health economics, implementation science, biostatistics and so forth expertise. And the idea is that should this model be demonstrated to be successful, we could actually apply it in other parts even of the country. So it is absolutely flexible enough to be implemented elsewhere.
Thank you.
And could it be implemented in sort of urban settings as well?
I wouldn't see why not. Obviously, that first part of the model needs to be conducted. So in terms of exploring the local needs and how they how to adapt Navicare to the individual community is important. Yeah, it does follow that same framework.
Thank you. I'll go to the member for Palmerston.
Thank you both for being here. Kelly, you mentioned in your initial remarks that Medicare cuts to telephone psychiatry had a big impact on these communities. Can you please elaborate and unpack that a little bit for us? What were the cuts? What was the impact?
The detail of the cuts, I can't tell you, the dollar value, but they have removed a lot of the bulk billing loading for certain telepsychiatry services, particularly for one-off assessments. And our local GPs, two of our letters of support, one from a GP, one from a practice nurse, have highlighted how significantly that has impacted their ability to get those one-off psychiatric assessments. It has definitely been an issue. I have a number of complex cases where psychiatric evaluation has been warranted, but the individual is not at crisis point, so the acute care team can't assess them, and there's no other options if you live 4 hours from Mackay to get that psychiatric evaluation. So it has very much impacted the community.
Are you free to share those letters of support with the community?
Absolutely. We do have a document that we'd like to table at the end of this that has all of those and stories of success.
Thank you so much.
Chair.
I'll just go to the member for South Brisbane first.
Thank you, Chair. Kelly, I was hoping you could elaborate on what you were talking about in relation to referring people to other social services, and to my mind, it kind of speaks to an understanding of mental health as a social condition rather than something that's very individual. Could you talk a bit about the services that you're referring people to and that kind of connection between those broader factors in mental health?
Absolutely. And I'll preface this by saying each individual and each individual case is different. But if someone is skipping meals and is only eating, toast and cups of tea for days on end, and they're living in their car, you could throw as much psychological support at them as you want, and it's not going to be effective, because until you take away some of those fundamental stresses, the intervention isn't going to be successful. So when we do an intake, we sit down and we just have a chat with the person, and we talk about all the different things that are going on in their life, and if they are unemployed, it's like, hey, can you afford groceries, and can you afford to pay your bills? And so we can link them in with all these, free legal services, emergency food vouchers. We've got rural family support, outreach programs that provide assistance in primary schools to support kids who are struggling with various things there. We link people with employment agencies and offer them skilling options. So our database doesn't just contain mental health services, it contains as many of those local wraparound support providers that we can find and we can access and we can link our clients in, because that holistic approach is absolutely essential to full recovery.
Thank you. And a follow-up, Chair, if I may. I wonder if you could also elaborate on the specific risks facing people in the agricultural sector that your submission touched on.
Shall we do that? So in the agricultural, in agriculture, there are a lot of stresses. They're subject to a lot of environmental disasters, floods, droughts, cyclones, bushfires, everything. And so they're very much on tenterhooks at times, and they can lose everything economically in the blink of an eye, and that can be really, really stressful. And so we do find significantly elevated rates of suicide in the agricultural area compared to the general population. On top of those very unique stresses, they tend to also have greater access to lethal means, firearms, poisons, and so on and so forth.
Thank you.
I'd go to the Deputy Chair for a question.
Thanks, Chair. Look, it appears to be a great initiative, and I guess there's some similarities there with the previous group that we saw around some of their programs. I just had a sort of a technical question, really. In your proposal, you talk about Mitsubishi Development Proprietary Limited. I was just wondering, are they just a mining company that have invested in the trial to support you, or is this a particular software product or infrastructure product that Navicare depends on to actually function?
No, they're our corporate donor, so the former is they are obviously they are interested in the mining community, and so wanted to support the mental health and wellbeing of people in that region, and had provided some initial funding for us to conduct this work.
Yeah. And did you, I don't know if you heard some of the presentation from the previous group, but they sort of talked a little bit about, I suppose, establishing sort of strong connections with each community. Does Navicare provide an opportunity for that, or would it be simply more be just a broader sort of telehealth online sort of product?
Well, Navicare is based physically in the Moranbah Youth Community Centre, so those that are seeking support have an opportunity to speak with Kelly and have that initial conversation, and should they require telehealth services, and Kelly will connect them with them. Otherwise, it may be, whether it's housing or, domestic violence support, wherever it might be, she's able to do that. But we are physically placed in the Moranbah Youth Community Centre at this point.
And we also have a telehealth facility at the Moranbah Youth and Community Centre. So if people don't have reliable access to internet, and I find that particularly in the older population, they're very hesitant to use telehealth. But with me being an actual human who can make them a cup of tea and set up the computer for them before they go into their telehealth system, appointment, it really bridges some of that gap and addresses some of the hesitancy that some populations feel about fully telehealth services.
Just go to the member.
Thank you.
Sorry, I'll go to the member for Mogul.
Thank you, Chair. Claudia, if I could just come back to the submission as well, and just with the reference there from Wesley Medical Research in relation to the establishment of the COVID-19 Rapid Response Research Centre, which was established in April of 2020. Are there any particular, trends in data or research that the Wesley Medical Research is sort of seeing with respect to COVID over the last 2 years in the body of work that you sort of do within Wesley Medical Research, and applicability to mental health particularly, but if there are any other trends that you're capturing as well?
So just to explain how this sits with that COVID-19 Rapid Response Research Centre, as you all know, March of 2020, we went into lockdown, and it just so happened that we were running a grant round at the time, and we had 5 applications from across the Uniting Care hospitals for COVID-19 research. And knowing that this funding that we also had for mental health support, we ended up pulling together a number of different projects and put them under the banner of the COVID-19 Rapid Response Research Centre, including this. At the time, there was modelling that indicated that suicide rates would double within 12 months. 12 months later, and today, we know that that wasn't the case. However, what has happened is a massive increase in people wanting to access mental health services. And in fact, Lifeline, who's also part of the Uniting Care, the broader Uniting Care Queensland group, have shown that they've had 50% increase in or more in people trying to access support. So I think that's what the issue is. It's not so much that more people are committing suicide, it's that more people just need some help. That's what the data's showing at this point.
Thank you. I'll go to the member for Palmerston for a question.
I've got a very simple question, which is, you talked about your ability to set people up for their telehealth, make them a cup of tea. So are the telehealth consultations occurring in a shopfront is not the right word, but in a given location that people attend, or are you going into their homes?
So we've established a telehealth hub at the Moranbah Youth and Community Centre. So there are a large number of other community services that run out of that area. So it's a very non-confronting place to go for your mental health support. A lot of the people don't have to use our telehealth facility. They can access the telehealth appointments from their phone, from their laptop, from their desktop computer. But there are people who, they're on a limited income, they don't have data, or like I said, the elderly people in particular, they like to come in and they don't want to fumble around with the computer and the links, and we can help them with that.
Great, thank you.
Any further questions? Look, I'd like to thank you for the work that you're doing, and thank you for the submission and for appearing here today. It really was a fascinating submission, and we've certainly heard a lot about the need for navigation, care coordination, case management. So it's a very interesting model that you're rolling out there. I don't think we took any questions on notice, did we? No. So with that, I'd like to thank you for appearing, and we'll break for lunch. Thank you.
Thank you so
Can
much.
we possibly table our document?
Yes, of course. Mary will grab that.